Hi, everybody. My name is Judy Mark. I'm the president of Disability Voices United. This is called SDP Connect. Many of you have been to SDP Connect before, and we generally talk about various issues related to the self-determination program. Well, today we have sort of hijacked this meeting to talk about some very critical issues that are going on in our community. And I didn't think there was going to be a lot of discussion about the self-determination program, but unfortunately, we will be talking about it today because it is in the target zone for some cuts. Um, so we have the way our day is going to work today is that we're going to start talking about what's happening at the state level in California, which there's really huge news today. And then at around 5 o'clock, we're going to move on to what's happening in the federal issues. So we're right now, there's currently a debate happening in the House Energy and Commerce Committee. And we will have a guest speaker from Washington to talk to us about what's happening there. And then we're going to pause for a few minutes after the state discussion to take your questions. And then we'll pause after Chuck speaks about the federal issues. And then we'll open up to any questions. So at that point, you'll be able to ask general questions about the self-determination program if you have them, plus any questions that might have been not answered about what's happening in the budget and Medicaid area. So to start us off, I'm going to introduce the amazing David Maxwell Jolly, who's appearing today, even though he has a cold. So thank you. David is a policy consultant from California Health Policy Strategies that has been working with DVU for a number of years now, and it has just decades of experience in state government, both within the executive branch and legislative branches. So thank you so much. David's going to walk us through what's happening right now in California. Go ahead, David.
Hey, thank you very much, Judy. It's a pleasure to be here. Today is the an important day in the annual budget cycle for the state of California. In January, as you may be aware, the governor comes out with his proposed budget for the coming fiscal year. This last January, proposed a budget for the 25-26 fiscal year. And usually there are programmatic changes, sometimes expansions, sometimes contractions, depending upon the availability of funds in those proposals. Today is the revision of that proposal. It's called the May Revise. And the reason that they schedule it in May is they just processed all of those income tax forms that people got to the state franchise tax board in April, and now they have a picture of what exactly the revenue is going to be for the state, and they have a good idea about how much money to count on for the state. And so the financial plan for the state is then limited by the sense of the revenue that the state's going to get in. And it's not until April, all the trucks are unloaded at the FTB in April, that they get to know exactly how much money we can count on for the fiscal year that's coming. It turns out this year, there were a lot of horrible rumors around big deficits, but it turns out this year the deficit was of modest size compared to some of the ones we've had to deal with in past years. The governor had to try to find a way to make up about $13 billion in reductions across the state budget from what would happen if no changes in programs and laws were made. And so what the governor's done is come forward with his proposal on how to make reductions in program spending if at the state to fit in with the revenues, not only the revenues that are going to come in this coming fiscal year, but also the ones that are expected the next fiscal year as well. So that's what the proposal came out today. The governor had a big press conference talking about a whole host of issues that were on the agenda. Later on in the day, the Secretary of Health and Human Services had a special phone call where they made presentations about the proposals. And there was an opportunity for people to ask questions about them. So we're getting a better and better sense. the real details of it are not yet posted on websites. And so right now you can't see a lot of the background detail that explains exactly how some of these ideas are going to work. But what we do have from the Department of Developmental Services is a set of proposals for making programmatic reductions. And Judy, I wonder if we could post that list up for people to see. This is out of the the Department of Finance budget summary. And here's the list of things that they are proposing in the Department of Developmental Services to address the budget shortfall. Um, if I just kind of go down the list, I'll give you kind of an idea of what these are. Some of them I don't know much about because we haven't really seen the detail. But oh, that's great. That really helps me too. First one is health and safety waiver assistance. There are folks that are, because of their the particular needs that they have for trying to get personnel to make sure that people are living home safely, they get waivers to the limitations on expenditures for in-home assistance. And those waivers allow paying a higher salary. They're proposing to eliminate uh, uh, those waivers and with a savings of about 3 million in general fund ongoing. Again, the details of this, how it's going to happen, when it's going to happen, we don't really have that yet. That will be revealed as over the next few days. Um, Bias training done by the at the regional center offices. There's a budgets that regional centers have for doing that kind of training. They would revert that money and not spend it. Um, there's direct services for professional workforce training and development. There's a reduction of $17 million. This is fairly substantial. And you can see $36 million in the following year to eliminate what they call direct services professional workforce training and development, um, which has not yet been implemented. Judy, I don't know the
Mhm.
background of this, but
Yeah. So for those who maybe have heard of it, they were calling it DSPU or Direct Support Professional University. It was really to try to professionalize the workforce of staff who support people with developmental disabilities so that they could take these kind of almost university level courses. It was hopefully going to be implemented through community colleges so that as people are thinking about the careers that they want to go into, they would think about becoming a staff member for a person with developmental disabilities. And they would learn all kinds of really ways to be person centered and other kinds of things. This is a long time coming, this DSPU, and there were lots and lots of barriers that were being put in the way of implementing this. And so because it didn't get implemented, they're just scrapping it, which is to me very disappointing.
the next item is particularly relevant here and is the self-determination program. They're proposing a reduction of $22 million that would be achieved in the budget year. And then the in the budget year, it would be implemented in a partial year, and the next year that would save $45 million in general fund. And these savings are proposed to come from uh, setting up new guardrails for the program. Essentially, what they are proposing to do is to put limitations on the process for establishing budgets, on the process for determining what kinds of services will be paid for and authorized. Those guardrails that they talk about here are not nailed down yet. I think people have a lot of different ideas about what they would do. Pardon me. Um, what we did hear from the Director of Developmental Services today is that he wants to engage folks to talk about exactly what kind of guardrails should happen here. So this is going to be a really great and a very important opportunity for participation in decision making at the state level to try to find out ways to make sure that the spending under the self-determination is paying for services that are really needed, and that there are the rules around how to determine what's paid for and how much budgets will be make sense. And so that's going to be a process that the department will start up in the coming year if this proposal goes through. And you want to add anything to that, Judy, at this
Yeah,
point? Or?
why don't you go through the rest and then I'll stop sharing and then we'll have a kind of a longer discussion just about the STP piece.
That's great. Rate reform, hold harmless. As you may know, there was a big rate study for providers in the DD community, and they established a set of rates that were reflective of sort of cost of doing business, more up-to-date cost of doing business. There were a number of providers of different types that were being paid more than what that rate study said they should be paid. And when the rate study was implemented, those ones who were getting higher rates than what what the community rate turned out to be were held harmless and not reduced. They're proposing for a reduction of $75 million in the first year. They don't have a next year number on it, but to reduce the rates of some of those providers who are higher than the rates of similar other providers in the community. There's a reduction of 10 million in Porterville. Um, and I'm not sure what the nature of that reduction is. When we'll have to wait till we get the details from the developmental services budget to find out exactly what the consequences of that would be. Um, re, Increased reimbursements and cost recovery. There's seeming savings uh, due to, it seems to me like this has to do with provider services and payments to provider services and recouping overpayments in that context. It looks like that's what this is. And the final one um, is the reductions related to the quality incentive program and most particularly thing here are the electronic visit verification system. The providers of services for the developmentally disabled have a system in place where the the just the you use an electronic system to verify that the provider actually was at the site where the services were provided. Um, and that system, while it has some difficulties, they're they're going to be requiring everybody to use it, and so that they will be able to verify whether services were actually given. So that's the list of issues within the Department of Developmental Services. There's one other Medi-Cal item that ought to be flagged. As you may know, in Medi-Cal, there many years ago, there used to be an asset test that people who had bank accounts or financial assets greater than a certain amount were not eligible for Medi-Cal services and had to spend those assets down before they were allowed to get Medi-Cal services, particularly in long-term care settings. Um, the asset test had been eliminated in California for all categories of people. They're proposing to reestablish it for the aged and disabled, particularly in long-term care. And in the asset level that they propose is a very low level. It's only a few $1,000s, and I think that could be very consequential for a lot of people.
Yeah.
There are other proposals related to individuals who are undocumented, and if you have any interest in that, particularly those folks that are getting services in California, Medi-Cal services, they're going to put a cap on enrollment for those folks, and so you may hear more about that as well. Judy?
Yeah, they're basically not going to enroll any new undocumented immigrants into Medi-Cal. And they are also going to, even the ones even the undocumented immigrants who are currently receiving Medi-Cal for their health care, there's going to be some costs imposed and a lot of limitations on the kinds of services that they can
And
receive.
a monthly premium of $100.
Right.
We should note that these are proposals.
Hmm.
The legislature basically has a month to consider these proposals in their committees and then eventually vote on the package of the whole budget by the end of the middle of June. That's their constitutional obligation. So these issues are going to be sorted out very, very quickly from the legislature's point of view over the next couple weeks.
Um, I have one more slide to show, but before we do that, we're showing closed caption in English, everybody, and it needs to stay in English. When you change it to your language, it ends up changing it for everything. And you should know that our Spanish interpreters use the English closed captioning to ensure they're getting the interpretation right. So please try to not change that. Thank you. So I have one more slide that I wanted to share just to show you where we believe the priorities are problematic. Um, and this is just a little piece of the budget that was put out today. So, there's all these cuts in the DD system, but there is an actual new appropriation of $30 million available over 3 years to Special Olympics of Southern California, who work, many of you know about Special Olympics. They're a really great organization. However, do we believe that they should be getting $10 million a year um, from our taxpayer dollars directly just for them? It's not a contract that a bunch of us can compete for to receive it, just for them when they're cutting things like the self-determination program, Medi-Cal, and other things. So I just wanted folks to see this piece because it was something that we had a call with the Secretary of Health and Human Services this afternoon, and I brought this up to them to say, hey, this is supposed to be helping people with intellectual and developmental disabilities. And why should one group get it when everyone should be able to benefit from that? So I just want to tell you that that's another advocacy piece. Okay, so now I'm just going to go into um, more specifics on the little bit that I know about the SDP cuts. So the first thing I can tell you, because we directly asked the director, Pete Chervinka, is that they do not know yet what they are doing. Exactly what David said to you. They are supposed to engage with the community, with stakeholders in the community to ensure that they are going to, use our input. But here's what I can tell you is that the budgets of the self-determination program are significantly higher than than what people were getting in the traditional system. That should be a surprise to nobody on this call because most people go into the self-determination program because they were underserved or not served at all in the traditional system. You should know that there are some regional centers like Inland where 40% of children receive no services at all. No one can be in the self-determination program if you receive no services. There's no such thing as a zero POS or purchase of service in the self-determination program. You have to have something in your budget, at least to pay for your financial management services, right? So for sure that somebody who wasn't receiving any services before and are now receiving services, they're going to be an exponentially large increase, right? But then even for folks who were getting a good amount of services in the traditional system, even when those people are going into the self-determination program, they are seeing in some cases double the amount of services than they were getting in the traditional system. Because of this, DDS wants to rein in the program. I have been warning people, not in as direct a way as I am today, but I've been warning people that this was coming. I didn't know it would be coming in the May revise. I believe that if our legislation last year, Senate Bill 1281, 12, what was it? I can't remember, 12, whatever it was, doesn't matter anymore because it's dead because it was vetoed by the governor. We asked, DD asked in that bill to create uniform ways throughout the 21 regional centers, standardized processes to create equity across the state so that people are treated the same, to create, systems so that we all know how the budget's going to work, what you can and cannot spend your money on in the spending plan. And they not only haven't done it yet, but they vetoed the bill that would have required them to do that. So it is very frustrating to me that we are now facing these restrictions in the self-determination program within the context of the budget and budget cuts, as opposed to a way to improve the program and break down barriers within the program. So we are now on the defensive, as opposed to what we were hoping, if that bill passed, to be on the offensive to support and sustain the self-determination program over years. The other thing I can tell you, because I spoke with Director Cervinka this morning, is that the waiver or the contract that the state of California has with the federal government on the self-determination program comes up for renewal in 2026. And there is some concern that in the process of getting that waiver renewed, that the federal government will start asking questions. Because in the waiver that was written back in 2015, it specifically says that our program will be what's called cost neutral. So that means in its entirety, on average, people will be spending about the same that they would have spent were they in the traditional system. Doesn't mean that one person's budget wouldn't be increased. It just means in its entirety. And that's just not the case. It's clearly because, as somebody is saying in the chat, people were not getting served in the traditional system. Those are the people that are going into the SDP. So I'm going to pause for a moment. I see Fernando has his hand up. If you could, Kaylee, if you could unmute him, and we'll take your question, then continue the discussion.
Thanks, Judy and David. Appreciate this really important and timely information. David, quick question to you. Can you expand, or maybe Judy, this would be for you as well. And when you talk about guardrails that are going to put limitations to the process, can you share maybe the top 2 or 3 guardrails that are in conversation and what they may look like?
So for sure, there is no top 2 or 3 because there are 0 right now. Right. And so obviously, maybe groups like ours and the Integrated Community Collaborative have some ideas about what we would potentially recommend. I would, by the way, never call them guardrails. I would call them clarifications, because guardrails makes it sound like you're putting up more barriers in the SDP as opposed to reducing the barriers, right? So some of the ideas I have is, let's clarify what you can and cannot purchase when you're talking about like goods, not services. Obviously, people should be able to get staff to support them. But there has been a lot of conflict around, can you buy this particular item or that particular item? Tickets to this, or a Peloton bike versus some other, going to a gym. We need clarity on that, because the fact that there is so much, confusion about it, that each regional center is making up their own rules. People are going to fair hearing over it because there's so much confusion. There's extra costs in administering it because regional centers are spending so much of their time trying to figure out what the rules are. The FMSs people aren't trusting them now because they're trying to figure out what the rules are. If we have clarity in what can and cannot be done in the SDP, there will be other costs, not the cost to our budget, but the overall costs will go down in the system. However, that's not going to be enough. And they're going to be looking at this. So they're looking at the budget much more than they're looking at the spending plan, everybody. So, because the budget is where the costs are, not in the way people are spending the money. So even though I believe that they need to clarify the spending plan too, but the costs are where they're going to focus. And it could be, what they could be suggesting, because I've seen it suggested before, is a much more intensive review of budgets over a certain amount. Let's say budgets over $200,000 or $250,000. That there will be a much more intensive review of how that budget was developed. Not how the money is being spent, but looking at, okay, what are the services that went into the budget? Like, were there personal assistants? Was it day program? Was it behavioral therapy? Whatever the services are in the traditional system that made up that budget, was that done in a way that was reasonable? And if in fact there are indications that it wasn't reasonable, I don't know where they're going to come up with that term and how they define it, but there is going to be potentially an audit of those kinds of budgets. So for those of you who have larger budgets, the target is potentially on you all. So I want folks to be prepared. Um, the other piece I think where they're going to be looking at are the differences between regional centers. So you have one more generous regional center where people have larger budgets versus a regional center with smaller budgets. I think they're going to be looking at how is that happening and what are the services that are going into them. I would say that even in the traditional system, the differences are there too. And so we would have to argue that, like, if you're in inland, whether you're in the SDP or in the traditional system, you're receiving fewer services than if you are at West Side. There's no doubt about it. So, okay, I'm going to pause. David, tell me your timing and how much more time you have.
Um, well, I'm gonna have to hang around.
Okay,
I'm not
okay, I
going where I was
appreciate
gonna
it.
go. So, yeah.
I appreciate it. Beth, you're the next question.
There we go. Sorry, my computer was not. Thanks so much for, of course, always all you guys' work. Judy, I don't know if you saw the email from Pete that went out just kind of right before this meeting. So two comments. One is the thing that Newsom said that caught me completely off guard this morning was that they're going to put a cap on overtime for IHSS,
Mhm.
which is a direct like 30% impact to families where the family member provides services for a person with a disability living at home. So for that small, I don't know how big that segment is, but that is horrific. Like that's bigger than anything we could have imagined before any of the other stuff even gets stacked on. But the
Yeah,
other thing,
so I'm going to stop you there to just explain to everybody what that cut
okay,
is, and then we'll take
yep.
your next comment. So in the state budget, on top of these cuts specifically in the developmental disability system, there are additional cuts that will impact us. And one of them is they've capped that it used to be that you could one IHSS worker could bill no more than 66 hours per week. That was the cap. And therefore, obviously, for those 26 hours above 40, you'll be receiving time and a half. That's a lot more money, right? So instead of the $20 an hour, you're getting $30 an hour for those extra hours. They are now capping that overtime to 50 hours a week. So it's gone from 66 to 50 for an individual IHSS worker. I can tell you that at the meeting with Secretary Johnson that just happened right before this, a parent brought that up, that that's going to be devastating to them because they are their adult child's primary IHSS provider and uses all of the hours and therefore, is going up to the cap of 66. So that's going to affect people's individual incomes by reducing the amount of hours from 26 to 10, where you can receive the time and a half.
But it not only in decreases the person's income, but it also decreases the person's services, the disabled person's services, right? So if the only option is for that family member to provide that service and that person still needs 24/7 support, then that's effective, again, a 30% reduction. Because I mean, I've done the math now, because it's me personally. That's a 30% reduction in that coverage for that person living at home. So that's going to force changes there that isn't just, and so it seemed to me like Newsom just didn't understand how things work, right? Like the last time there was a reduction in IHSS, they did it as a percentage of the overall amount of money, which is a vastly different way to do it, and it spreads it out more broadly across the population. So, I'm hopeful that the right people will have the right conversations to kind of at least tweak that. I mean, I understand there may be a cut there, but we should make sure it's not like devastating a percentage of the population, similar to your Special Olympics comment. Then the other thing, sort of to piggyback on what you said, Judy, is that in Pete's note, he also talked about, along with the decreases, there's also a big increase in handling the increased rate of claims and fair hearings. So they're providing additional budget in that area. And I think as we advocate, we should push back on them to say, no, take that money and use it to provide the more specific details on what you're eligible for and what you're not. Because most of those fair hearings are arising out of that ambiguity and those claims. And so if they would just get their shit together and put out specifics, then they won't need that extra money. So that, to me, that's just wasted money. That's just throwing more money in the trash can that's not needed because they're not addressing the root cause. And just for giggles, because I used to live in Maryland, I went in and looked at their self-determination program because they recently made a change. They go item by item by item by item. It's like so specific. It's like night and day to California. So there's lots of room there for us to advocate. That's all. Thank you.
Thank you. Okay, I'm gonna take Tina and Connie, and then our next speaker is here, and we're gonna move on. I promise we'll go back to questions about the SDP. Oh, Tina, are you gonna chime in later? Because I just saw your hand go down.
No, I put it down because you said you were taking me, so.
Oh, no, I am taking you. I'm gonna take you and Connie, and then we're gonna move on to talk about what's happening in Washington. So go ahead.
Okay, I have a couple of questions. I went to the SCDD meeting this morning, and I came out of it with a couple of questions that other people might have as well. One of my questions is, they explained to us that one of the things that happened with what Congress is doing is that they listed HCBS services as optional, not required for states to fund. Isn't Regional Center Services HCBS, and aren't most of our self-determination program services HCBS? So that's really scary if we're optional, because I'm sorry, but my life's not optional. I intend to live through all of these cuts.
So that is an amazing question for Chuck when he comes on next, because that is actually a federal question and a great question. So I'm going to put that on pause, and then I'm going to have you ask in a second, okay?
Okay, my second question is, they talked about the work requirements that are happening.
Oh, same thing. I'm going to stop you there.
Oh,
That's
wait on
also
those?
a federal
Okay.
excellent question. We're going to get to that with Chuck in a second. Thank you. You are so knowledgeable about the federal stuff, Noti. Go ahead, Connie. It says Harvey Lapin, Kaylee.
Oh, good. You didn't unmute me. First of all, the good news is that you're doing this. I try to find a rainbow everywhere. Thank you so much for this information, although it's very sad. So I'm one of the old people. So I've been through this budget cycle like David has for many years, but maybe I've even beaten him. I don't know. My son's 57 and has severe challenges. Where's the operational side of this, the operational budget cuts? Because usually they throw that in. I mean, it's making me a little crazy, but I'm hanging on to see where that interfaces with all the direct services.
Did you see any operational cuts? Oh, you're muted, David.
Yeah, I actually I saw an old nugget, old friend among the budget cuts. They saved a whole bunch of money by eliminating vacant positions. And this is a fight that I've had over many years, because but in any case, there are a number of vacant positions, some of which are vacant because the department is forced to redirect vacant position money to buy computer equipment to make sure that they can get by to automate services so that they can get by without filling the positions. But nevertheless, there are some structural reductions that are a part of this package. They don't strike out you. That one of them was this substantial reduction in state budgets because of vacant positions in the thousands. So that's one that I saw, but that's the only one that I've seen so
Yeah.
far.
that we
In
just
my
can't.
opinion, there's a lot of bloat in the operations budgets. And so the fact that besides the vacant positions, we didn't see cuts, that was very frustrating to me.
I just want to say that's pretty scary because even in the worst of times, we always saw something. I mean,
Mhm.
more than just vacant positions.
Yeah.
So we have to keep our eye on that. Thank you.
Yeah. In the good news department, folks, for those of you who care about rates, they did not roll back the massive rate increases for providers, which actually not only benefits allegedly direct support professionals in the traditional system, if in fact the money is trickling down to them, but it obviously it's very beneficial to people in the SDP because our budgets are increased based on the rate increases in the traditional system. So I just want to thank David. I don't know if you can hang out because I'm sure after Chuck speaks, there's going to be more, but I want to thank you, especially considering that you have a cold today. Although your deep voice sounds,
I am not normally such a bosso.
yeah, you're sounding a little bit like Darth Vader, but that's okay. We know you're actually a really good person. All right. We're now going to switch over, folks, to talk about what's happening in the House. Um, I would love to bring Chuck Konigsberg on screen, but before I do that, I'm going to just share my screen and show everybody what's currently happening right now in this is the hold on, I have to stop sharing because I think I forgot to say share sound. There we go. And so this is your lovely, hold on, let me see if I can make this happen. There we go. Go do it. There. Okay. Okay, so this is
Mr.
currently,
Bishop.
and Chuck, I wanted to show this video to show that this is currently, it's now
Mr.
8
Bilirakis.
o'clock at night, and this is called the House Energy and Commerce Committee.
Mr. Hudson.
And Chuck is going to explain what they do. They worked, I think, most of the night last
Mr.
night,
Carter.
and they worked all day today to speed
Mr.
through
Palmer.
these cuts on Medicaid.
Mr.
And
Palmer
I'll go
votes
ahead
no.
and put in the chat after I stop sharing screen the link to how you can watch that video because we should all have our eyes on what's going on there. So now I'd like to introduce Chuck you guys all know Chuck now because this is his like third or 20th time or something speaking to us. So Chuck is an old friend who is an expert on, oh, whoops, I'm still sharing this. Sorry, everybody. Stop there. Chuck is an old friend who's an expert on the federal budget process, having worked in Capitol Hill and in the administration for many years. Chuck, tell us how bad things are.
Okay, actually, well, can you hear me first of all?
Yes, for sure.
Okay. Actually, what they were seeing there was a videotape of the committee meeting, which ended earlier today.
Oops, I had no idea. See, I have no idea. I'll still put in the chat how you can see the video.
So anyway, what's going on generally is that 10 committees in the House were instructed to come up with lots of changes in their jurisdictions to cut taxes and increase certain types of spending and cut other types of spending. And 9 out of the 10 committees have finished. The committee that you saw on the tape there was the Energy and Commerce Committee, which controls Medicare and Medicaid. They finished earlier today, and they approved their package 30 to 24. They actually, in order to ram this through without people not really knowing very much about what it does, they stayed in session all night last night and forced Democrats to offer their amendments in the middle of the night. And they finished this afternoon, and they passed it on a totally party line vote of 30 to 24. There's only one committee left that hasn't quite finished yet. That is the Agriculture Committee, and they're working on cuts to the SNAP program, which is food stamps. And they're still tinkering around with that. My guess is they'll probably finish tonight at some point. Then, with all the committees having finished their respective pieces of this bill, the House Budget Committee puts it all together into one huge bill. Again, it's a huge bill that nobody has read in full, that the Congressional Budget Office has not been able to go through and score in its entirety, but they're trying to ram it through as quickly as they can. And probably the House will vote on the full package next week. They're going to be tinkering around with it until they can ensure that they have 218 Republicans voting for it, because that's what they need to pass. And there's still some Republicans demanding some changes in order to get their votes. But having watched very closely how the House has been working this year since Trump became president, I think it is unfortunately likely that the House will pass the bill next week. After that happens, the Congress goes into recess for Memorial Day, and then in June, the Senate will take up the whole matter. And I expect that the Senate will make a fair number of changes to the bill. And in the Senate, Democrats, while they will lose all the votes in committee, Democrats can still offer amendments to strike out pieces of the bill on the floor and at least get votes on those amendments. At the end of the day, unfortunately, I think some form of this monstrosity will pass. But Democrats basically in the Senate will have two kinds of tools at their disposal. One is they can offer motions to strike out particular pieces of the bill, and that's where you need to work very quickly with the California senators on pieces of the bill that you would like them to try to strike out. The other tool that they have is that there's a very complicated rule called the Byrd Rule, and that enables any senator to try to strike out pieces of the bill that don't have any budgetary impact, because this is a very special kind of bill called budget reconciliation, and it's special, and the Republicans are using it because it cannot be filibustered. So Republicans can pass it without any Democratic votes. But because of this very special type of fast track that it's on, there's this requirement under the Byrd Rule that every single provision must have a budget impact. If there are policy changes to Medicaid and food stamps and other programs that don't have any budget impact, that just change policies, Democrats can get those stricken from the bill. And it would take actually, and that's actually a powerful weapon, because Republicans would need 60 votes to overcome that type of objection. So Democrats have a lot more leverage in the Senate than they do in the House, although at the end of the day, Republicans can pass what remains of the bill without any Democratic votes. So in terms of all the details that are in the bill, honestly, everybody's just trying to figure out what's in it at this point, because they just released the bill late Sunday night, and it's a very long and involved bill. And the nonpartisan budget estimators at the Congressional Budget Office haven't even had time to go through the whole bill. So at this point, all the advocacy groups and media are still finding lots of things in the bill and trying to figure out exactly what it does. As far as what this bill does with Medicaid, let me just pull up that part here. So let me just step back for a minute. In general, the bill cuts taxes by around $5 trillion. It increases spending for defense and immigration enforcement by about a quarter trillion. And then to pay for it, most of it's paid for by borrowing. It's just deficit spending.
Mhm.
But they're trying to make about 1.5 trillion in budget cuts to pay for part of this bill. And the biggest piece of the spending cuts, unfortunately, is to the Medicaid program. The preliminary estimates are that it would cut over 700 billion over 10 years from Medicaid. And the main ways that they would do this are by limiting the state's ability to impose what are called provider taxes on hospitals and other types of providers. Um, that will hit states very hard because it comes right out of ways in which the states raise money to pay for their portion of Medicaid. And it also cuts the federal matching payments to the states. So that's one big piece. Another big piece is it imposes work requirements on childless adults. Um, the summary language says that people with disabilities are excluded, but advocacy groups need to look very carefully at the language to make sure that it in fact does that. And just as an aside, one of the most notable things about this particular budget bill is that if you were to read the Republican description of the bill and the Democratic description of the bill, you'd think that you were looking at two completely different bills. Um, and I hate to be so blunt, but there's a lot of lying going on the Republican side about what's actually in the bill. And that's why everyone's having to take a very close look at the legislative language. And I'm hoping that there will be a good summary of what's actually in it before the House actually votes on it next week. But they are literally, they put this together at the last minute and they're ramming it through as quick as they can so that people don't really know what's in it.
Mhm.
Getting back to the details, so I mentioned that they're freezing provider taxes, they're imposing work requirements on childless adults. They're also allowing states, they're not requiring states, but they're allowing states to impose up to $35 co-payments on Medicaid for people just above the poverty level. And that's really a very new kind of thing. In the past, Medicaid has never been treated as an insurance program. It's been treated as a health coverage program without any co-payments. This would, for the first time, allow states. This probably wouldn't happen in California, but it would allow other states to impose up to $35 co-payments for various types of visits. And then there are other reforms as well, but those are the three biggest pieces. And the preliminary estimates from the Congressional Budget Office are that it would cut over 700 billion from Medicaid over 10 years, and that by the end of the 10-year period, close to 8 million low-income people would lose their Medicaid coverage because of all of these various changes. And so when you're talking to members of Congress and to your senators, the thing to keep in mind is that these huge cuts in Medicaid are being used to partially pay for these huge tax cuts, which disproportionately go to the wealthiest taxpayers. To be clear, most people would see tax cuts in 2026, 2027, and 2028, the years that Donald Trump remains in the White House. They've made sure that people will be seeing increases in their tax refunds and possibly some reduction in their tax withholding. So they're trying to make people feel good about this by giving small tax cuts to most people, but again, the largest portion of this huge tax cut goes to the wealthiest people. And the way that they're paying for it is partially by heavy cuts to Medicaid, to food stamps, which is currently still being worked on by the Agriculture Committee, um, to
Environment.
yeah, they're also rolling back most of the, well, nearly all of the environmental investments made during the last administration. They're imposing fairly large cuts on federal workers and also education is getting hit pretty hard. They're placing limits on student loans in a way that will limit the amount of money that people can access for federal student loans. And they're also imposing new rules on Pell Grants, which will end up limiting who is eligible for Pell Grants.
Mm-hmm.
So overall, they're trying to make this a feel-good bill for everybody by putting in some tax cuts for almost everybody.
Mm-hmm.
And people will notice that in their tax refunds next year, which is an election year.
Mm-hmm.
But low-income Americans are going to be hit really hard by the Medicaid cuts, by the education cuts, by the food stamp cuts, and that's the policy they're choosing.
Yeah. So I'm gonna call on Tina because she had a couple questions in the last round that were really more for you than for David. But at the same time, I would love, Kaylee, for you to pull David back in because David did some estimates based on the federal cuts on how they'll impact Californians. So let's start with Tina. Go ahead, Tina.
Yeah, one of my questions has to do with the proposed budget cuts and how they decided what was required for states to pay and what was optional. Um, they made HCBS services optional, and I don't understand why they did that because HCBS services is regional center services. It's IHSS. It's self-determination. And a lot of us live in the community because of self-determination and don't really want to be in facilities. So why did they do that and how can we fix it?
Okay, what I'm going to do with questions that I don't have the immediate answer to is write them down, and I'll look it up and get the answers back to Judy as soon as I can.
So
Thank
Judy,
you, because my life's not optional. I plan to survive these budget cuts somehow.
well, could I speak up, Judy? Can you hear me? Yeah.
yes.
Um, Medicaid has a whole bunch of services that are optional. In its initial reincarnation, Medicaid was just pay the doctor, pay the hospital, pay the lab, just basic medical services. And a lot of other services are optional, like dental services, optometry, home and community-based services, IHSS, that's optional. All of that's the way Medicaid is structured. So when they're saying that they're optional, it may be because of that underlying service. In California, for people with developmental disabilities, we have the Lanterman Act, which establishes an entitlement, and it's not optional in California. And in fact, if Medicaid doesn't cover something that's included among the services that are available to clients of the Lanterman Act, you get it anyway, and there's no federal money in it, but you get it through with just general fund money. So that's kind of how the way the rules are around all of that.
Yeah. I think that as David said, in California, I think we're going to be fine. I just think that there are additional concerns that I have. Well, stay on, Tina, because I know Chuck, you and I kind of texted about this a little bit yesterday, and David, I want to bring you in. Because California is a state that provides health care for all, regardless of your status here in the United States, we are among the targets to have even additional cuts, more cuts than either other states are having in Medicaid. My understanding, and I am not a budget expert, but my understanding is that we will have an additional 10% cut to our federal matching funds from the federal government because of because we provide health care for all. Am I getting that right, Chuck?
Well, it's they're trying to force states to drop universal coverage.
Right.
So the cuts will happen if California and New York continue to provide health care for all. They're trying to, I mean, it's a very curious thing because on the one hand, they talk about not having an overbearing federal government. On the
Right.
other hand, they're using this law to try to force California, New York to stop covering, to stop providing universal coverage. And so the way that this is written, if either of those states does not drop that universal coverage of undocumented people in their states, then their federal Medicaid match would be cut. It's I mean it's blackmail is what it is.
It's the match.
And just in terms of strategy, I would assume and hope that your senators would be on the floor offering a motion to strike that section out of the bill. They there's no way that Republicans can avoid voting on this if they offer the motion to strike it out of the bill.
Mhm.
So there will be a vote on this if
Yeah.
your senators call for one.
And we had talked earlier about the governor's revised budget that came out today. So this is a very big day. And in that budget, they do strip, he recommends stripping back a lot of the health care for people who are undocumented already. And so we're already seeing that blackmail and that pressure campaign playing out in what the governor wants to do. I think there's going to be a very big debate in the legislature over this, everybody. So, unfortunately, that debate is going to end before the Senate passes their version of the Medicaid, on their funding of the Medicaid. So it's very unclear how this is going to end up. But I just want people to grasp what that 10% means because David has come up with his real guesstimates because it's so hard to know of what the Medicaid budget cuts could mean for people with intellectual and developmental disabilities. But those cuts, they're pretty enormous, but they do not even include this extra 10% that we might be getting penalized here. So I don't know if you want to comment on that, David.
Well, as I understand the extra 10%, it's 10% for the expansion for the Affordable Care Act childless adults. It's not the
Yeah,
overall.
it's 10% overall, is the
Is it
way I read
overall,
it. Am I wrong, Chuck?
Charles?
Maybe you could look back at that. Like I read it as 10% of the entire FMAP or the federal. Nina, did you raise your hand? Did you have a comment on this or something else? Oh, you're muted. Let her unmute everybody. Okay.
No, I had a separate question for
Okay.
Chuck.
Okay. Come back then. The way I read it was a 10% overall cut, but once again,
I
not the
thought it
expert.
was. I mean, a lot of conservatives were advocating, and the most conservative representatives in the House were advocating taking the federal sharing ratio from 90% down to whatever the usual rate was for these Affordable Care Act populations. And what I thought was that uh, and the reason that they advocated that is they thought that because we were saving money on these people, then there's money left over for us to expand to undocumented people.
Okay,
So
I've got the answer.
no, you
Okay.
did great.
It reduces by 10% the federal match for Medicaid expansion states.
Yeah. So it's just
Oh,
the childless adults
Medicaid
vote.
expansion, right?
Yeah. That's the
For all
childless
of us
adults.
or what?
It's any state that has chosen to expand to these non-categorical people that the Affordable Care Act allowed. And they're getting 90% federal match on those right now. So this would take that down to 80. And, I mean, what was our number was uh
Actually, I'm
resource.
reading the committee summary, and I think it's deliberately vague. So
Mm.
Oh, is it?
I'm gonna have to look at the language.
Okay. I thought it was this in lieu of taking the 90 down to 50 for California, it was you're going to knock 10% off of that. Uh, and right now we get about an extra, if he did knock it down to 50%, we get about an extra $6 billion.
Oh,
So,
actually,
10,
the way that it's titled, it says reducing the expansion match.
and that's
So
the Affordable Care Act
yeah,
people.
yeah,
Yeah, yeah.
yeah. So it's 10% of the expansion.
Judy,
You know, the
is there
42 that from 90 down to 50%, or that 40% federal share, we lose about $6 billion. So if it only goes 10%, it'd be a quarter of $6 billion, which is what is that? $1.25 billion. So it's still a hefty chunk.
I
And
just
the thing
want
is,
to note,
all of these cuts put together are going to put a huge squeeze on states,
Mhm.
and you don't really have any way of knowing what the states are going to do to live within these new limits. So it's very hard to predict exactly how the states will respond
I
and
just want
who's going to
to.
get cut.
I just want to point out I know, and I just did it. We want to try not to talk over each other because it's harder for the interpreters. Of course, I'm guilty of that a lot.
Sorry.
Um, Tina, did you have another question?
I had two questions, but I actually have three now because I need to ask a really quick question because there's something I don't understand. Everybody seems to be upset because people don't have documents. Why don't they help undocumented people fill out their documents? Why they send people away instead of giving them the help they need so they can stay? I don't understand. Can we help them?
Yeah, we agree.
My
Well,
other question.
Yeah.
I would just say this is the big difference between the Trump Republicans and the Republicans of old.
Mhm.
Um, you may not remember, but when Reagan was president, um, there were about 3 million undocumented migrants, and he signed a bill that gave all of those people a pathway to citizenship. Um,
I
that's the
know it
state.
can't be free to it can't be
That's
free to deport people. They're spending money on airplanes. Why don't they just help them fill out their documents and let them stay?
I know, I know. It makes no sense. That's who's in the White House right now, and that's
Mhm.
what's driving all this.
All right, my other question had to do with the work requirements that they're talking about because it's really hard for people with disabilities to get jobs. I haven't had a job until just recently, and I don't work enough hours that I'll be able to keep my Medicaid because they require you to work 80 hours a month. That's a lot for people that have a hard time, and it's a lot for people that it's not easy to get a job. Sometimes you can only get part-time jobs. Like I can only hire 4 people full-time. Everybody else that works for me works part-time. So what's going to happen to them? And am I going to have to beg for more hours or find a second job just so I can go to the doctor?
So let's clarify some things around the work requirements. Chuck, I'm going to throw it to you because I believe that there is an exemption for people with disabilities, but I'm not exactly sure how it's written. Chuck, do you know?
Well, the section by section says the work requirement would not apply to the following individuals: And the list they have here is includes individuals who are blind or disabled, in addition to others who are exempted. Again, it depends. How it's actually applied would depend on the specific language, which I haven't looked at yet. And that actually raises for me a strategic point, which is when you talk to the staff for your two senators, there's a lot of stuff they can do on the floor. One that are helpful. One of the things they can do is the senator can get up and pose a whole bunch of questions to the chair of the finance committee about how these Medicaid provisions are going to work, and that becomes legislative history, and you can not only get a clearer answer of what they intend, but you can actually affect the outcome. Because if you can get for example, if one of your senators gives a list of 15 or 20 different kinds of disabilities, is this exempted? Is that exempted? Is this exempted? That is a very useful thing to happen on the Senate floor, because it becomes the legislative history for when they write the rules that implement the provision. So in general, they appear to have an intention to exempt all disabled, but it's really important to get it nailed down on the Senate floor.
Yeah. All right, Tina, I'm going to throw it now to Kavita. Kavita, did you have a question? And I know there's a lot in the chat too that I'm going to get to as much as I can. Go ahead,
Yeah,
Kavita.
hi Judy. It's kind of already been answered, but I just wanted to find out about the guardrails, especially this was a while ago for the self-determination program. Even I think guardrails sounds more barrier-like,
Mhm.
and I really think that um, you know. I don't know what kind of advocacy is going to happen for this, and how we can make a difference, and how we need to bring this up. So, would do you be doing more trainings on a CBO level as to what we need to bring up and with whom?
Yeah, we plan on being very, very active in the advocacy around the cuts that have come at the state level, and the lack of clarity around what they actually mean. So we will be reaching out to every single one of you who are on this call, everybody, to really, really get involved. I'm going to just take a couple questions from the chat. Uh, Mia was asking that she watched the committee, and is there some place that she could see a concise tally of how everyone voted, and also on the amendments, or was it a straight line partisan vote?
The vote to approve the package was straight party line, and my guess is that well, I know that all of the Democratic amendments were defeated. My guess is that almost all of those, if not all of those, were party line, but there is no tally that's currently available. No. Typically, the tally on all of the votes in committee would be placed in the committee's report, but they're rushing this thing through so fast that I don't think there's going to be a report before this whole thing's done.
Wow.
And unfortunately, they control all the rules, so they're just going to break the rules and go ahead without all of the usual information.
Yeah. All right, I'm going to go back to a question that was about the cuts to the self-determination program in the state budget. Emily asked, how does that size of cut compare to the total budget of the SDP? So the cut was around $23 million. And I can tell you that last year, the SDP cost about $480 million in the state. So I don't know what that percentage is, but like 5%, 6%, something like that. So I would say that there aren't similar cuts to other programs like there is. I think the STP is being particularly targeted, so we have to ensure that we're really in charge. Um, some people were asking related to the SDP around whether there are going to be eliminations of social and recreation, or these kinds of services. And so I don't think it's going to be like that at all. I don't think they're going to pick a particular service. I think they're going to investigate. They're going to create rules about how to create the budgets for individuals, and then they're going to uh, require all of the regional centers to work in exactly the same way. Nina, I'm going to bring you on to ask your question.
Okay, great, thanks. So Chuck, apologies if I just didn't hear this, but what happened? What was the fate of the re-enrollment every 6 months requirement? Is that not there, or is it still there? Or at some point there was talk of that there'd be
Yeah, my understanding is that they did include that.
okay, because that is super onerous, like super onerous.
But
Yep.
the way I read it was it's not for the DD community. It's for the people in the Medicaid expansion would have to. Yes, I agree that it is onerous, but it is
Okay.
not our community. It is for the expansion.
Okay, and then going back, so the exemption, there's an exemption if if you're disabled from the work requirement. But who's got the burden of proof there? Like, if you are in another program considered, getting services because you're disabled, is that you're automatic? You don't have to do anything. And also, what if you're disabled and have a job, which is a huge thing, that it's a huge goal of everybody. If you're a working disabled, does that implicate like the work requirement somehow? And then finally, who does the regs for this? How is this implemented? Are these HHS regs? How does this get like, the details of like definitions and things?
Okay. First, I just want to mention I found the legislative language for the exemptions, and they exempt people with disabilities by incorporating by reference the definitions in medic in already in the law. So they're not writing at least it's good that they're not writing a more narrow definition of disabled.
It's SSI rules, you mean? Is that you're saying?
Looks like, let's see. Title 18 is I would need to check that quickly.
18th Medicare, right?
Yeah, sorry, I don't have ready answers to everything, but I'm sorry. So your question was,
How do they
What if
implement?
you're working disabled? You meet the definition of disability. So if you're exempt even if you're working, right? So right, I just want to make sure that's the case.
yes,
Okay.
yes.
And then my just last question was, how is this implemented? Like, who does the regs for these, for all of this?
That would be done by the Centers for Medicare and Medicaid Services, CMS, which has just suffered huge cuts in their workforce, which will slow down implementation. But that's who does it.
Thank you.
That's great. Sherry, I'll bring you on.
Hi. So my question has to do with federal process. Since some of these provisions don't go into effect for, until the current legislators who are voting on it are not there potentially, could a future legislature significantly change provisions that haven't yet been implemented? Meaning like, the next house, should it change?
Oh, yeah, I see what you're getting at. Um, I think what you're asking is, could this be undone?
Well, what I'm asking, I know in California, we have rules about what future legislatures can do. There's rules about
Yeah.
what you can flip.
Well, well,
But
the big picture is that there's a reasonable chance that the House will flip next year, but it's very unlikely that the Senate will flip. And in any event, that almost doesn't matter for this particular question because um, any attempt, even if both chambers flipped, any attempt to repeal this would be vetoed, and then it would take two-thirds of the House and Senate to override the president's veto. So um, this can't, none of this can really be undone unless there's a total flip in the government in 2028.
or bipartisan change
Yeah.
Okay, thanks.
But again, the senators do have considerable leverage when this goes before the Senate, and it's always in order for senator to move to strike any provision of the bill, so they can go through this and any provisions that their states have strongly objected to, and that's where your voice has become really important over the next couple of weeks. Any provisions that they want to get separate votes on, they can get the votes. And in the end, um, quite a few of the senators are in close races, and they may actually win some of the votes. In the end, the overall package will pass, but Democrats may be able to strike some of the more egregious provisions. Because the Senate is so narrowly divided, it's just 53 to 47. If they get, four senators to be sympathetic to their motion to strike, then the provision's out. So there really is room here to knock out some of the more egregious stuff. And in the end, what they really want is they want the overall package passed, and if they have to lose some of the spending cuts, they're just going to go ahead and pass it anyway. So if they're facing really strong arguments on the Senate floor about what particular provisions can do to hurt a lot of people, those provisions can be knocked out because in the end they know that the overall bill will pass anyway.
Yikes. Okay. Okay, I have a bunch more questions in the chat. So some of these questions are about the self-determination program as well. Uh, who is actually being audited? Because I was, so remember, this is just my guess. There's nothing in writing that says anybody is getting audited. But well, who is actually being audited? Is it how the budget was created, or will they audit the service providers as well? So I do not know. In fact, I don't even think DDS knows what they're going to do. I would guess, just because I've seen them talk about it before, that they will be auditing budgets that are of particular large size. And when you say it's how the regional center created the services that go into the budget, not necessarily the service providers that people are using. Like I don't think it's on the spending plan side. I think it's on the budget side. So I think we'll be okay in that area, but folks should know that this is potentially coming. Um, Somebody's asking a question that's a little confusing to me. Erica asked, would the Medi-Cal change remove the DD waiver for getting Medi-Cal? I don't really understand. Do you understand what that question would be, David? Because the DD waiver is different than Medi-Cal, folks. So the DD waiver or the developmental disabilities waiver is about the home and community-based services that Medicaid pays for. That is different than Medi-Cal. Medi-Cal is a health insurance or it's a health care program for poor people and disabled people. So Medi-Cal is basically another name for Medicaid, but Medicaid funds lots of things, not just healthcare. They also fund services and supports for people to live in their communities and not be in an institution. We only have a few minutes left, and I'm going to go to Melissa in a second. But here's what I want to say is that our advocacy, even though it feels like we failed in the House of Representatives this week because our advocacy did not achieve our goal, which is to defeat the budget, I actually believe our advocacy is working. And we shouldn't be stopping our advocacy. We should be ramping up our advocacy now. And the reason I know that it's working is because the original budget that they wanted to put through was way worse. This may ultimately be a bad budget too, but it was way worse what they were talking about. They were talking about things called per capita caps. They were talking about block grants to the states. I don't even need to explain those because they're no longer on the table. But our advocacy is working. And all of you who've been showing up to the rallies, I was at a rally on Tuesday. We had our Disability Week of Action. Hey, Eric, can you put our wonderful film that you made in the chat so that people can see the incredible advocacy that DVU and other disability groups were involved in a couple of weeks ago? I believe our advocacy is working. And I want to give just a quick shout out to Tina, our outreach specialist and Howard McBroom Fellow. Tina called every day for how many months to her congressman, who is Jay Obernolte, who sits on the House Energy and Commerce Committee. She is a constituent, and she called every single day. And guess what? His office called her today, and he personally wants to meet with her next week. She has a meeting directly with her member of Congress, one-on-one, next week. And that is what persistent advocacy looks like. And so we cannot stop. We have got to keep fighting. And I'm going to let Melissa come and ask the last question. And then I tell you about, we are not done. We have a couple of really big actions coming up in the next couple of weeks. So Melissa, why don't you ask your question?
Well, it's not really a question, it's a comment. So Harbor Regional Center had a meeting a few weeks ago about social rec. So it was not self-determination, but about social rec. And they said, our policy always has been one activity per quarter. And we've kind of bent the rules and we've made a lot of exceptions and are giving a lot more than one, but we really need to get back to one activity per quarter. And somebody asked, is this related to the national government and the expected cuts?
Mhm.
And they hinted that it was. So I'm just sharing with you what was at the meeting. And in regards to,
Let me just stop you there, Melissa. And I'm going to make clear to everyone that no regional center should be doing anything to anyone right now because these Medicaid cuts have not yet happened. And the regional centers are using monies that have already been designated for them. The budget has already been passed and is in that from last year and from the state. So nobody should be cutting anyone at this point. So go ahead, Melissa.
well, as I said, their policy was one activity per quarter. And they've made a lot of exceptions and they wanted to try their best to get back to what their policy was of one activity per quarter. But in regards to, and I apologize because I jumped on here late, but in regards to auditing, I'm definitely seeing a lot more in budgets where it says, for example, like North LA is starting to ask for independent living progress notes where they never did before. There's other regional centers that are asking for reports from the providers. So I think that's their way of making sure that the services are really being provided as they were intended to be. I don't think it's a bad thing. I think it's just a way for them to put their finger on it a little bit more than they have been.
Yeah. The problem that you're seeing is the lack of consistency across the state because DDS has not written specific rules that explain to regional centers and to the community what is happening. And so I'm hoping that these rules might be coming. So I'm going to pause here and I'm just going to say for people to make sure you're on our mailing list. So I'm going to tell you that next week we have two major actions happening. DVU is working with many other organizations across the state, health access organizations and labor unions and other disability rights organizations. And we're doing two events. The first one is on Tuesday, and it is going to end up in front of Congressman Valadeo's office. And the second one is on Wednesday. For those of you who may have heard that it was on Thursday, we've now changed it to Wednesday. And that is going to be in Anaheim. And I've been begging during this whole call to the groups who are organizing it to get us the flyer so I could get it to you before this meeting ended, but they did not get their act together. This is what's going to happen. It's going to be an incredible event, and everybody needs to stop what they're doing and show up because it's our last big chance to influence it. We're going to be meeting about a block or two away from the Congresspeople's office, and we're going to do a funeral procession. We are going to have many, many coffins. We're going to have pallbearers. We are actually looking for some strong people to carry the coffins, and we're going to have actually priests and ministers and rabbis who are going to basically do a death, that the healthcare system has died because of what these cuts could bring. And we're having people with disabilities in wheelchairs and other people with disabilities walk behind the caskets holding signs saying, "Are we next?" Because we know that with these Medicaid cuts, people will die. And so I know that not everybody lives in Southern California near Bakersfield or Orange County, but these are the two members of Congress that we feel we have the best chance who will vote against this budget on the floor. Congressman Valadeo and Congresswoman Kim. And so we are going to be sending out email blasts. Make sure you're on our mailing list. Make sure you are following us on social media, because we are going to let you all know when these are going to happen. So I know Vivian, we only have 1 minute left. Vivian, can you just speak real quickly?
Hi, sure. About the social recreation stuff?
Sure.
Yes, and thank you, Melissa. Please feel free to follow up with me or anyone else on this call who may have heard about this. We've also heard that North LA and Orange County also some similar things might be happening where regional centers may be preemptively limiting or restricting services in anticipation of cuts that have not even happened yet. So Pete Travanka has said that is not okay, which is great, but they're still doing it. So we will continue to follow up with DDS leadership on this. If you hear of anything else like this, please reach out to me at DRC. Thanks.
Perfect. Thank you, Vivian. So everybody, I just want to thank Chuck and David for joining us today. Chuck's like practically part of the DVU family now because he comes so often. And Chuck is a dad, so he gets it. Thank you everybody for joining us today, and we will see you all really soon, hopefully next week at one of these events. Take care, everybody. Bye.